hear from a Conservative MP. It's Richard Holden, the Conservative MP for North West Durham now. Richard, good evening to you.
Good evening, Ian.
I imagine you were watching the Prime Minister earlier. He looked absolutely shattered. Did he strike the right tone, did you think?
I thought so, but I mean, I think this is just such a. It is a milestone today, but but I thought he did strike the right tone because it is tragic that so many people have died of coronavirus in this country, and actually not just here, but also around the world. We've got to remember we are facing that global pandemic, but that with the vaccine, some of them which have been developed in this country, the Oxford vaccine. Deliberately to try and not just reduce deaths here, but because it's a lower cost option to reduce them around the world, including in some of the poorer countries in the world, that we do have light at the end of the tunnel now as well. I mean, my mum's works in a local community hospital in East Lancashire, and one of her friends who's a nurse died of coronavirus a few weeks ago, and I know for that little hospital that's really hit their team there, and so many friends of my grandparents as well who've been either killed or have been really, really seriously ill with COVID-19. But I think we do have some hope, and I think that's the important thing at the moment, which we didn't have in the same way a couple of months ago, because the vaccine rollout it really is very rapid, and it really is starting to make a real difference now.
The mantra from the government at the beginning of the pandemic, going, I think, really right through the summer, was we've done the right thing at the right time. Would you accept now that there were some things which they didn't do, and certainly didn't do at the right time?
Well, I think, it's quite clear, and Chris Whitty said it himself today in the press conference, that, for example, on wearing of masks at the start, the scientific evidence wasn't that it was that effective, but over time they realised it was. Some of the other things, which the new treatments and stuff that have come out, clearly at the time we weren't aware of, and maybe some of that could have been speeded up. But I think there's of course there are going to be lessons learned from this. I think we're learning some lessons already, and I'm sure the government is in how they deal with it, and lessons for the future as well are so important on this sort of thing, because I think one of the things that we have learned from this is having not had this mass pandemic for so long, because the other real issues that we faced in this sort of sphere, SARS and things like that, didn't really to have that global reach that COVID-19 has had. It also makes us better prepared for the future.
You're a communications expert. You used to advise ministers on their communications. If you're advising the Prime Minister now, would you not say to him, look, if you admit that you've got things wrong, it's not going to do you damage. People will respect the fact that in hindsight, you admit you could have done things differently, but you had to operate on the evidence available. Would that not be a good thing to do now?
I think the government has basically said that all along, that not everything is going to be perfect, and in hindsight you can say this is what we might have done differently, this is what we might have done differently here. But these decisions have huge impacts on both sides, and I think that's the important thing we also need to remember. Closing schools, for example, which are currently closed, except for the vulnerable children and children of key workers. That has a huge impact on people's education, on kids' mental health. So there's two sides to every decision. There is not just one easy answer to any of these points. So, I'm sure there are things that people might have done slightly differently and at different times, but we've got to remember that you're not dealing with there isn't an obvious lever to say this is a no-cost option. There are huge costs associated with everything that the government's doing. With £280 billion into the economy to keep it going and keep people's jobs there on furlough. The government has spent literally £4,000 per head of population over the last year just on those extra coronavirus measures. And that's not accounting for the huge loss of tax revenue and everything else you've seen. So those things will have to be paid back over time. So there's a huge amount of stuff that has been done. Could you have done more in certain circumstances? Is it all perfect? No, but I think overall, and the key thing I'd like to come back to really is the vaccine. The one thing that is going to lead us out of this is the vaccine. And on that, I think you'd have to be pretty harsh to say the government hadn't got it pretty bang on in terms of the efforts that have been made there, the way it's been procured, the way it's been distributed.
Well, let me ask you about that, because of course you represent a seat in the North East, and I think the North East has effectively led the country in the rollout of the vaccine. But over the last week, there have been issues with supply and suspicions that supply is now being diverted away to other parts of the country, East Anglia, for instance, which are being, shall we say, a little bit slower on the uptake.
So, well, I think there's a couple of key points here. So I had several calls, including with Labour colleagues as well, and it's very clear that we're getting our full allocation of the vaccine. There's no doubt about that. But 98% of my care homes have been done in County Durham. 80% of over 80s. We've been ahead of the curve on that. But the key thing is that all of those most vulnerable, wherever they live in the UK, in those top 4 groups, get it as quickly as possible. But there's definitely no shifting of the allocation. Everyone who needs it is going to get it by the middle of February, that first jab. And quite a few of my constituents, particularly the most vulnerable, when the doctor's recommendations have come through, for the second as well. So I think it's, we've got to do this on the basis of need, and I think that's the most important thing when it comes to the vaccine. We've got to vaccinate the groups who are most vulnerable to getting ill, or in terms of hospital workers potentially transmitting the illness as well. And I think that's the important thing, that everybody who gets it, everybody who needs it, gets it first.
Richard, thank you. That's